Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. We will be discussing about very important, that is the road traffic accidents. The road traffic, or in short we can call it as the RTA. So RTA related injuries. So they are nothing but they are very common injuries related to the RTA. So the first will be we are dividing into various headings. So the first will be the unrestrained driver. Unrestrained driver. So by unrestrained driver, the injuries could be the face or the head injury. So it can be the face or the head injury. Next, it can be the cervical spine injury, the steering wheel impact injury, that is a thoracic injury. So because of the steering wheel, you can have a thoracic injury. Next is you can have pelvic fracture as well as the leg fracture. So pelvic as well as the leg fracture can be seen. Next is we move on to the seat belt. So what is meant by the seat belt injury? Seat belt injury, it can include the bruising, the rupture of the mesentery of the small intestine. There can be abdominal aorta injury and the lumbar spine fracture. So to name a few important ones, there's abdominal aorta injury. And as you know, the seat belt, it can cause bruising, and then the mesentery, rupture of the mesentery. The mesentery is also injured. And the lumbar spine, this is important, the spine injury is also seen. So spine, what exactly in the spine? It's a lumbar spine. Next is the airbag injury. So airbag injury, as you know, it can relate to the facial bruising, the amputation of fingers and fractured arms, and cervical spine and the head injury. So airbag, what we need to know is the cervical spine, whereas the seat belt was the lumbar spine. The seat belt was the lumbar spine, and seat belt has a L, so it is lumbar spine. Airbag, it is a cervical spine. Next is the front seat. Next will be the front seat. So under the front seat, so next is the front seat. So here in the front seat, the pattern of injuries is similar to that of the driver, but this position, the car is even more dangerous. So as a front seat passenger, you will have a major impact compared to that of the driver's seat. The rear seat, the injuries are more fatal and compared to the front seat. So what we are saying is, the rear seat, they are dangerous. Rear seats are danger. Rear seat people are very dangerous. And next, motorcyclists, the basal skull fracture and the hinge fracture. So there is a basal skull fracture, that is in terms of the motorcycle, and there can be brush abrasion as well as tailgating. So as we know, there can be hinge fracture, hinge type of fracture. Next is the pedestrians. In terms of pedestrians, you can have a lower limb injuries as well as the head injuries. To learn and grow daily like this, please do subscribe.